rare case of herpes simplex esophagitis in an immunocompetent adolescent on isotretinoin therapy. Herpes simplex esophagitis, or HSE, is a rare entity with a prevalence of 1.8%, not typically seen in immunocompetent adults. Patients are more often teenage males and typically present with symptoms of odynophagia, chest pain, and fever. Treatment with isotretinoin has been implicated in the emergence of herpetic infections, notwithstanding herpes simplex esophagitis. Clinical course. A 19-year-old man with acne presents with 6 days of 8 out of 10 constant, central, stabbing, non-radiating pleuritic chest pain, along with odynophagia and odynophagia to solids and liquids, associated fever of 102 degrees Fahrenheit, shortness of breath without cough, and one episode of vomiting without hematemesis or coffee grounds. He had no prior history of PUD or GERD. He denied recent flu-like illnesses, sore throat, ill contacts, or travel. He reported performing unprotected oral sex but denied previous sexual transmitted infection, penile discharge, or rash. On me- Only medication was isotretinoin, started 3 weeks prior for acne. On exam, noted discomfort with swallowing with normal vital signs. Pertinent labs included white blood cell of 9.3 with 0.9% lymphocyte distribution, erythrocyte sedimentation rate of 31, and rapid strep influenza A, B, RSV, and COVID-19 were negative. Esophagram, shown in figure 1, showed abnormal mucosal contour and multiple irregular plaque-like lesions. CT of the chest showed mildly enlarged mediastinal lymph nodes and mild splenomegaly. He had esophagoduodenoscopy, or EGD, which showed severe esophagitis with white plaques and scattered small ulcerations. Biopsies were taken. Patient was started on empiric diflucan and isotretinoin was stopped. Results of biopsy seen in figure 3 showed histology of granulation tissue with soft, smooth muscle, exudate, and degenerative squamous cells with viral nuclear inclusion. CMV and GMS stains for fungus were negative, but HSV immunohistochemistry was positive. Follow-up HSV DNA PCR was positive. HIV was negative. Absolute CD19 lymphocytes were normal. He was started on acyclovir and had good response and was discharged on oral valacyclovir. Discussion. HSC is an uncommon form of esophagitis and typically occurs in immunocompromised patients. It has been described in immunocompetent children, but is less common in immunocompetent adults and adolescents. HSC has a 3-to-1 male to female predilection, with majority of cases affecting teenagers. Here, we discuss a teenage male presented with odynophagia, typical ulcerations on endoscopy, and positive testing for HSV1. Additionally, our patient was recently initiated on isotretinoin. The emergence of HSV infections in patients with isotretinoin has been described in the literature. It has been postulated that isotretinoin can cause mucocutaneous side effects with epidermal dysfunction and conjunction with lymphopenia, allowing for HSV infection. Acyclovir has been widely shown to be the treatment of choice, and isotretinoin therapy should be stopped if on board. In conclusion, herpes simplex esophagitis is a rare in immunocompetent adults, but it is important to recognize the individual on isotretinoin therapy may have slight predisposition to this condition.